Hi, guys. My name is Shauna Chin. I am an actress and an activist, but most importantly for this video, my expertise is as a former United States Army trained registered nurse. Now, if you haven't been following me, I usually post quick tips. And what quick tips are um, free to low cost benefit options that are available to freelance entertainers such as myself that don't have a typical 9 to 5 job that provides those benefits. And so for this COVID-19 pandemic, I wanted to go ahead and talk to you about free to low cost health options that are available, right? All right, so the first thing that we're going to talk about, well, actually, we're going to talk about 5 key things in this video. The first is where to find free to low cost health centers in your particular area. 2, what the actual procedure is to get tested and what that looks like for you independently and having your plan, right? 3, if you are undocumented, what does that look like for you? Because there are options available, and we'll talk about what those are. And 4, what 2 key things you need to have in your home in order to be able to ready to fight this pandemic on your own for your family. And then 5, which is one of the most important, I think, is what the wealthy are doing while they're in quarantine, right? And what are low cost ways that you can help to mimic that thing and what they're doing for your family, right? All right. So, the first one, which is where to find a free to low cost health center in your area. It's important for me to say before I get into that, um, because COVID-19 is considered a pandemic, the United States government already has systems put in place where no matter where you present, there are options available to you that are free to low cost, whereas COVID-19 related treatment and testing, right? So, but if just for general purposes, you wanted to know if you have a free to low cost health center in your particular area, just for in the future, or should you have a non COVID-19 related illness where you can present, just go ahead and comment below with your city and your state, and I'll be able to tell you where those free centers are located, right? All right. The second thing, which is your procedure to get tested, and why I said earlier that it's going to be individual for each person, it's going to be different for each person, is because your procedure to get tested should include the most important thing, which is your plan. And your plan is going to be specific based on um, you and your family, what that looks like. I wrote a list so I wouldn't go off track too much. All right. So the procedure that I think should be important is one, knowing where you're going to go for testing, right? That's the first important thing that should be included in your procedure in order to get tested. Knowing where you're going to go for testing, right? For some people, it's different. There are public health departments that are in your area that they provide testing, but also local physician's office and emergency rooms do provide testing. But what they're trying to say is not to inundate these centers if you can manage those symptoms at home, right? So the key is, if you've had the flu before, what did you normally do, right? Do those things first before you initiate and contact any of these centers, the primary doctor or your emergency room, right? Try to treat it at home first. If you then figure out and say, okay, you know what, I can't manage it at home by myself anymore, that's when you present for the treatment, right? But as you can see, that can feel like it's late to some people. It's like, oh crap, I'm really sick. Like, now what do I do? That's why what I'm saying is important. You need to have the plan in place, right? So that you know, okay, once it starts hitting the deck, you already know what you're going to do, right? The second thing in that is where you're going to go for treatment. Because where you're going to go for testing and where you're going to go for treatment can potentially be two different things, right? Like I said before, the public health departments, they provide the testing, but you won't necessarily go to them for the treatment, right? So you'll want to look ahead and see which hospital are you specifically going to go to, right? Which emergency room, what does there. So let me use me for an example, right? I know that I'm not going to go to my primary care doctor if I get sick, right? What I know is, should I get sick, I'm going to monitor myself at home. I'm going to self quarantine so that I don't bring it out into the community. Once I start getting a fever, I will then use Motrin. Motrin works better for me. Some people it's Tylenol. I prefer the Motrin. So I have Motrin on hand. I will take that and keep my temperature at bay. I will monitor how I'm breathing. At any point where it starts coming where it's hard for me to catch a deep breath, right? So I'm taking a deep breath, but it just can't get to where I think the oxygen needs to go, right? At that point is when I'm going to then present to my particular hospital and my emergency room. What I know ahead already in my plan is that I'm not just going to go directly into my emergency room because there are other people there who are sick that I don't want to get sick, right? My hospital that I have chosen for myself in my procedure has actually tents outside that are specifically for COVID-19 testing. So, what I know is the moment it becomes out of control for me, I'm going to go to the hospital, but I'm going to direct myself towards those tents, right? I'm going to present to them, I'm going to tell them I have already been treating myself at home. I feel sick, this, and then they will then take over for me and initiate what their process is, right? So that's what that looks like for me. And if you are having a difficult time figuring out what that looks like for you, please feel free to go ahead and send me a direct message, and you and I can help you walk through what that should look like for you and your family. All right. All right. Another thing is knowing what questions they're going to ask you, right? Again, like I said, the key thing in fighting this COVID-19 is the preparation of it, right? So, what does it look like? What questions are they going to ask you? They're going to ask you where you have been located, like where you live, where have you traveled to? Have you recently traveled to China, Iran, Italy, Japan, South Korea, or the UK? Have you been in contact with someone who has tested positive for the COVID-19? They're going to ask you, have you been in contact with someone who has traveled to any of those areas, right? Um, have you been told by a public official that you may have been exposed? They're also going to ask you, are you experiencing any of the following symptoms? 1, a fever, 2, a cough, 3, a runny nose, and 4, a sore throat, right? If you're having any of those symptoms, they're also going to ask you, are you having the shortness of breath? Which the shortness of breath is the key. The reason the shortness of breath is the key to how they're going to treat you, whether or not they're going to send you home or whether they're going to keep you for treatment, is that shortness of breath, that difficulty. I'm not talking about I'm having a trouble panicking and having a shortness of breath. Again, I'm talking about what I said before about the deep inspiration, having a difficult time taking that deep breath, right? That's what they're considering a shortness of breath. The reason that's important is because the COVID-19 presents, the reason it is so deadly is because it presents by giving the sick individual the pneumonia like symptoms, right? And when you have pneumonia, that's when you have that hard difficulty trying to catch your breath, right? All right. And there's a lot of people, like example, from where my hometown is in Jamaica, we know that people have what we call walking pneumonia, right? And it's a real thing. You're walking around, you're having these symptoms that you don't even realize sometimes that you are that sick, and it can get out of hand really quickly. So you need to have a plan in place, so that should you start developing that key symptom, right? Because at that point, it's hitting the deck and it's go time, right? All right. Another thing is they're going to ask you if you're 65 years or older, if you have any cardiac or heart disease, if you have any pulmonary disease, asthma, chronic obstructive pulmonary disease, those things like that, as well as if you are immunosuppressed, right? If you are a chemotherapy recipient, if you are a transplant recipient, those put you in a very high category, right? All right. The other thing that should be included in your specific procedure is knowing what the appropriate treatment is, right? I know a lot of times people are getting frightened because they're like, oh, well, crap, I feel like I got sick, but they sent me home and they're not treating me, and now I have to self isolate. What does that mean? It truly is okay. All right. Again, like I said before, the reason they're not they're having people treat themselves at home is because most persons will recover from the flu-like symptoms by themselves, right? You can manage it at home. The time for treatment is when you can no longer manage it at home. That's when you present for treatment, right? And treatment is going to be based on pneumonia-like treatments that are currently available, right? Because this human coronavirus is number 7. It six before the six viruses before the 6 human coronaviruses before this, the treatments are not effective because this being number 7 is bigger, badder, right? So the previous ones, until we can develop herd immunity, until we can develop a vaccine, until we can develop a treatment that is actually effective against it, we're now in the phase of trying to develop and figure that out, right? So that's why treatment is being so challenging at this time, which again is important for why you need to have a plan in place, right? Because once it starts occurring, it's a rapid succession that you need to always stay ahead of it, right? The other thing, which is the last one in your procedure, having your procedure in place, is knowing how you and your household are going to maneuver this should one of you get sick, right? God forbid it's the breadwinner. What are you going to do? Who are you going to call? Is auntie, sister, mommy? Who is on deck to help care for your family should you get sick? When you present to the hospital, knowing that most likely, if it is COVID-19, you're going to be there for a while, that they will not allow you to go out into the community being this sick. So they will quarantine you there in the hospital. So making sure that you have your iPad, your charger, all of those things on hand with you so that when you're in the hospital, while you can't go outside, that way your family can have some contact with you if you have the luxury of having those electronic devices available to you. All right. Um, okay. So now the third thing that we were talking about, which is undocumented persons, right? Okay. There are what's called sanctuary states in the United States, and I will post those below. Outside of that, there is a law in place in the United States called EMTALA, right? It's an acronym EMTALA. And what EMTALA stands for is Emergency Medical and Treatment Act. It's called EMTALA. Look it up. I can't tell you right now what the acronym is off the top of my head, right? But what it's an emergency medical treatment. So it means that no matter what, if you have $0.00, if you're undocumented, it doesn't matter what is going on in your personal history. right? As long as you are having an actual emergency room, as long as you're having an actual emergency, you can legally present to any emergency room and they are legally bound to treat you. All right? They're legally bound to treat you, that they will not ask you what your immigration status is. If you present to them for treatment, not only do they have to treat you and stabilize you before they send you home, they also have systems in place where they can apply for what's called emergency. In California, our Medicaid is called Medi-Cal, right? When you present to an emergency room, if you don't have insurance, they have systems in place where they can apply for an emergency Medicaid for you in order to help offset what your hospital and emergency room bill would have been, right? Um, Even if you don't qualify for that emergency Medicaid, because of the EMTALA law, they have to still treat you before they discharge you. Okay? They cannot withhold treatment. So that's very key and important to know during this time. But again, like I said previously, when I was talking about the free health centers that are available in your area, know that due to the fact that COVID-19 is a pandemic, there are already systems in place that provide for free to low cost treatment that are COVID-19 related. All right. The last thing that, oh no, number 4 is what do you need to have on hand at home? All right. So, oh, here. This is called a pulse oximeter. It tests what your oxygen level is. It uses, if I turn this on, you can get them at any pharmacy, CVS, Walgreens, it doesn't matter, wherever. Amazon. This pulse ox, I put my finger in it and it tells me what my oxygen level is. Is it going? Is it reading? It says up here it's 90. No. Oh crap. It's not even reading it. Oh, there we go. All right. So it tells me my heart rate is 78 and it tells me my oxygen level is 99. What? Me a shot. what what that means and how you read that is anything that 100% is of course the absolute best oxygenation level, right? When it starts going anything below 90 is when it starts getting very tricky, right? And then you're having the trouble breathing, and then you want to make sure that your oxygen level is always above 92%, right? And if you are a smoker, this number can be very different because when you're a smoker, your oxygen level is different just from a person like myself who is just a non-smoker. I have the probability of having a higher oxygenation level on a normal basis. And you, because of a chronic system, have, you know, it's normal for you then to have a lower oxygenation level. So, which is why it goes back to what I was saying before about planning. Planning is important during this time in knowing what your specific procedure for yourself will be, because you will then need to go ahead when you get your pulse oximeter while you're healthy. Go ahead, stick it on your finger and find out what is your normal pulse oximetry level, right? So that way, when you're at home and you are in a self quarantine situation and you're home self monitoring, once you put that on your finger, if you're sick, you know any fluctuation in that number. If it drops below your particular number, you know when to start going to the physician, right? Okay. Then the second thing is having a thermometer, which I don't have a thermometer at home. So I know for me, my plan that's in place is incomplete. I need to go tomorrow, bright and early. I need to present and purchase a thermometer, right? Because you want to be able to have a way to test your temperature. The two key things, again, like I said, when you're talking about COVID-19, the illness that it presents is by having pneumonia. That's why it's so dangerous and crazy, right? How you can monitor pneumonia at home is by monitoring your fever and by monitoring your oxygen level, right? So that's why you need to have a thermometer and a pulse oximeter, right? All right. And they should be pretty inexpensive, right? The fifth and important thing is what the wealthy are doing, right? So I'm not suggesting for you to go out and purchase stocks or for even figuring out what stocks are or anything like that. What I am saying to you is that there are stocks currently that are cheaper than usual. And so it's important at this time to find a financial advisor who is able to give you some tips and tricks into choosing a stock that could be beneficial for you, right? Because there is going to come a time when we do bounce back, the stock does go back up, and you want to be able to know already what stocks are you going to buy now while they're low so that you can, right? All right. The other thing is businesses. If you have a small business, there is currently, I know, especially in New York, a friend of mine, Kim, just posted in her area in New York, there is currently a system in place for their small business relief, right? So you want to be able to find out in your area if you have a small business instead of being at home and worried and saying, Lord, how am I going to do this? Know that there are systems that are being put in place currently for you. What does that look like, right? If you don't have a small business, you are out of work and unemployed, there are currently unemployment programs that are in place. I know for California, where I live, they are expediting unemployment applications. I know that if you work in the entertainment industry, like myself, they have provided a system in place for us. Um, Stimulus checks are being offered by the government. If you would have had to have filed your taxes, um, those things are put in place. And for you specifically, like I said, I can't emphasize enough through this entire video, all of it is going to be independent to you and your household. You have to know what's best for you. And again, if you don't have a clue where to start or what that looks like, please feel free to DM me and I can help you walk through it and see and develop a plan for you in what that looks like. Right? All right. There is a lot of information that is being circulated. I want to take the time to emphasize that for Jamaica, the Ministry of Health is the sole source of information that you should guarantee that that is legitimate news. For the United States, it's the CDC or the Center for Disease Control. For no Center for Disease Center. I can't think of about what my acronyms are today, but the CDC, right, for the U.S. and of course the World Health Organization, right? Those three things. Those are the key when you're talking about information and where to find your information. You want to make sure that yes, you can always listen to videos like this and all sort of things, but you want to be sure that people are crazy right now with providing fake news, right? You want to be smart. You want to know ahead of time. You want to make sure that your key source of information are your government entities, right? That are going to be able to give you up to date, in time systems and processes that are in place, that they have put in place specifically for you and your community, right? And you should make sure that you utilize them as much as possible, right? I don't want to make this a 5-hour long video, so I hope I got everything out that I was hoping to say. If there's anything that you have any questions at all, please feel free to message me, feel free to make a comment, whatever it is. Know that I'm here and I have the information. So I am more than willing to share it with you so that you and your families can continue to be safe and healthy. All right. If you are looking to talk to me, I am at Shauna Chin on pretty much all the social media platforms. I will see you. Bye.